नमस्ते बेटिया, खुश रहो बेटिया। आई जीवन डॉक्टर नम्रता नंदवाना, असिस्टेंट प्रोफेसर, डिपार्टमेंट ऑफ प्रैक्टिस ऑफ मेडिसिन, फैकल्टी ऑफ होम्योपैथिक साइंस of Jyoti Vidyapeeth Women's University, Jaipur. I had discussed in previous session Pityriasis versicolor and Pityriasis alba. Now I discussed today about Pityriasis rosea. Pityriasis rosea is also known as Pityriasis sarcinata. What is Pityriasis sarcinata? Sarcinata means circular patches. Pityriasis rosea means pink colored patches. Rosea means pink colored scales, yeah, macules. It it is papillosquamous disorder characterized by large erythematous scaly plaque called as herald patch, followed by secondary lesions. Means large plaque मिलेगा. What is plaque? Plaque means more than 2 centimeter मतलब flat plaques. erythematous मीन्स रेडनेस मिलेगी. ठीक है, उसको बोलेंगे हेरल्ड पैच, जो कि स्पेशली किस में दिखेगा? पिट्रेसिस रोजिया में, बाय सेकेंडरी लीजन्स. दिस वन, the site of lesions are trunk and proximal extremities with Christmas tree appearance. Now, etiology of Pityriasis rosea. The etiology of Pityriasis rosea is unknown. It is more common in winter season. Epidemiology of Pityriasis rosea. The approximate incidence of rosea is 2%. It affects usually 10 to 35 years of age. Now Pityriasis versicolor 20 to 40 years of each group, and then Pityriasis alba in childhood, and Pityriasis rosea is 10 to 35 years of age. It affects both genders and incidence is lowest in summer season. Whenever Pityriasis versicolor is most common in male and incidence is more common in heat and humidity. Now, sign and symptoms of Pityriasis rosea. The eruptions are usually seen by prodrome of sore throat, gastric disturbance, fever and arthralgia. Means associated symptoms भी दिखेंगे. The main symptom is appearance of herald patch, जो कि large erythematous plaque है, which is located on neck or proximal extremity, is seen in 90% of cases. Usually people complain of mild pruritus. Pruritus means itching. Now diagnosis. Serological testing to rule out syphilis is advisable in patients diagnosed with Pityriasis rosea, as secondary syphilis can closely mimic Pityriasis rosea. Means सिफिलिस की हिस्ट्री रहेगी इफ़ पेशेंट को पिट्रोसिस रोजिया है. सो पास हिस्ट्री इज इम्पोर्टेंट ड्यूरिंग केस टेकिंग. नाउ वी विल डिस्कस पिट्रोसिस रूब्रा पिलैरिस. इसके वर्ड मीनिंग में ही इसका मीनिंग हाइड है. Now, Pityriasis rubra pilaris is rare inflammatory papillosquamous disorder. As the name suggests, the characteristic lesions, Pityriasis means scaling, rubra means pink color से orange color में convert, and pilaris mean follicular papules. Sorry. Now the etiology is unknown, is most, though it is familial in few patients, probably autosomal dominant inheritance, means genetic history mainly इसमें रहेगी. Epidemiology mostly seen in 2 age variants, जुवेनाइल वेरिएंट, जुवेनाइल मतलब यंग एज ग्रुप, from 5 to 10 years, and adult variant from 40 to 60 years. The affected areas are trunk, dorsal aspects of digits, yellow orange thickening is seen in palms and soles and nail plates. Now, sign and symptom. Grip establish 5 types of Pityriasis rubra pilaris based on clinical features, age of onset, prognosis. Subsequently, sixth subtypes is added due to recent association with HIV. Type 1 classical adult onset, type 2nd atypical adult onset, type 3rd classical juvenile onset, type 4 circumscribed juvenile onset, type 5th atypical juvenile onset, and type 6 HIV associated. ये 6 टाइप्स को जो एस्टेब्लिश किए हैं वो ग्रिप थे. Sorry. Systemic symptoms such as malaise, fatigue, fever, chills accompany Pityriasis rubra pilaris. Diagnose कैसे करेंगे? PRP is diagnosed based on classical clinical and histopathological features. Now, Pityriasis lichenoides chronica. Pityriasis lichenoides chronica is relatively mild form of Pityriasis lichenoides. It causes development of small scaling papules on skin. Onset of people is gradual. Initially, they appear pink and scaly, gradually flatten and become brown in color over period of weeks. Now, etiology of Pityriasis lichenoides chronica is unknown. In some cases, people with PLC have had infections including Epstein-Barr virus, toxoplasmosis, and HIV. Now, diagnosis of PLC, Pityriasis lichenoides chronica, is based on clinical presentation of eruption on skin, and a skin biopsy confirm the diagnosis. This one. Now, pleva, last type of Pityriasis. Pityriasis lichenoides at Varioformes acuta. It is uncommon skin disease that present as a skin eruption of multiple small red papules that develop into polymorphic lesions with periods of varying remissions as well as sequelae of hyperpigmentation and hyperpigmentation. दोनों तरह के बैचेस दिखेंगे. Symptoms include burning and pruritus. Most commonly occurs on trunk, extremities, flexural areas, but diffuse and generalized pattern may also occur. This one. Now, histological examination of a skin biopsy, a specimen is standard for identification of pleva. Now, differential diagnosis, vitiligo, leprosy, and psoriasis. Vitiligo में वाइट कलर के मैक्यूल्स पैचेस दिखेंगे. देन पिट्रेसिस में पेल कलर के दिखेंगे. विटिलिगो में स्केलिंग मार्क्ड होगी. व्हेनेवर पिट्रेसिस में स्केलिंग इतनी मार्क नहीं होगी. ठीक है. लेप्रोसी में स्किन कंडीशन भी एसोसिएटेड रहेगी एंड नर्व इन्वॉल्वमेंट भी एंड मस्कुलोस्केलेटल सिस्टम भी इन्वॉल्व रहेगा. न सोराइसिस. ठीक है. सॉरी, सोराइसिस एंड पिट्रेसिस. सोराइसिस में स्केलिंग बहुत मार्क्ड रहेगी, सिल्वरी स्केल रहेंगे. इसमें स्केलिंग इतनी मार्क्ड नहीं रहेगी एंड सिल्वर स्केल प्रेजेंट नहीं मिलेगा. सोराइसिस में ऑस्पिट साइन प्रेजेंट मिलेगा, पिट्रेसिस में नहीं मिलेगा. नाउ मैनेजमेंट ऑफ pityriasis. The key is to educate the patient on the benign nature of the disorder. The affected area should be protected from sun exposure, as darkening of the surrounding skin may worsen the cosmetic appearance. Sunscreen may help prevent the lesions from sunburning and decrease the darkening of the surrounding skin. Patients should be informed that causative agent of Pityriasis versicolor is a commensal fungal agent of normal skin flora and therefore is not contagious. Good personal hygiene may be helpful in limiting recurrences. Specifically, patients should take shower as soon as possible after participating in exercise or activities that produce perspiration. Next one, homeopathic management. Various type of medicine of homeopathic medicines in homeopathy for pityriasis: arsenic album, basilinum, sulfur, mesareum, Netramas thuja. Thank you.